Welcome and thank you for taking the time to view this video introducing Module 6 of Alcoa's Leaders Toolkit for Healthy Living Workshops for Older Adults. This is the 7th in a series of 7 videos that have been created to guide you through the introduction and modules of the toolkit. Module 6 is about adopting a healthy lifestyle and understanding its impact on chronic disease. As the final module in the toolkit, its content is focused on adapting a healthier lifestyle that can help to manage or prevent chronic disease. Chronic diseases are diseases that last a long time and generally advance slowly. In Canada, the most common chronic health conditions are cancer, cardiovascular disease, and diabetes, followed by chronic obstructive pulmonary disease, asthma, depression and anxiety, and arthritis. In Module 5, Mental and Emotional Health, we have discussed depression. This final session focuses on diabetes, cardiovascular disease, and cancer. Many factors influence the way in which we live. For example, our values, our resources, our upbringing, and our cultural beliefs and expectations. Individual lifestyle choices affect not only a person's health, but also the health of their family and community. And if one extends the understanding of health, individual choices also affect society at large. When facilitating this module, it's important for you, the community leader, to avoid making personal value judgments about participants' decisions to engage in unhealthy activities such as excessive alcohol consumption, smoking, lack of physical activity, or unhealthy eating habits. Creating conditions where people can make healthy lifestyle choices is just as important as providing information on what to do. A healthy lifestyle involves a number of elements working together. We've provided a number of resources for each of these components in this and in the other modules of the toolkit. You may also want to brainstorm with participants specific examples of the way they live healthy lifestyles. Have they made any changes since the first session? The Toolkit and Community Leaders Guidebook contains more information and resources on physical activity, proper healthy eating, and suggestions to change certain lifestyles. We have also added 4 charts to participants' personal passports so they can track their lifestyle changes after the workshop sessions are over. To understand diabetes, it's helpful to know a little about the digestive process, the function of the pancreas and insulin, and how these are related to diabetes. We've included a simple breakdown of this process for you and a list of signs and symptoms. It's important to recognize, however, that many people who have type 2 diabetes may display no symptoms. There are risk factors for type 2 diabetes that cannot be changed, but there are also risk factors that can be. These are the same risk factors for many other chronic diseases. If you sense your participants need more information, you can access the resources from the Canadian Diabetes Association or from the organizations mentioned in this module. Among older people, heart disease is more common than any other disability except arthritis, and it's the #1 killer of older men and women. Researchers have found that the habit of being physically active over many years can help protect against heart disease. The Canadian Physical Activity Guidelines for older adults 65 years and older is a useful resource for you as facilitator to review in preparation for this module. As well, more information and recommendations are provided in the toolkit and our other resources, including descriptions of the physical nature of everyday activities that can be done around the house. Research has shown that regular physical activity can reduce the risk of developing certain kinds of cancer, including colon cancer and breast cancer. Physical activity after cancer treatment can have numerous benefits, improving both physical and mental health. In Module 6, you will find more information on the effects of physical activity and its relationship to cancer, and also details on recommended amounts and intensity of activities. Be sure to remind participants to consult with their oncologist or healthcare team first. They are in the best position to advise participants whether they are ready to exercise, as well as how much, how often, and how hard. You can also invite guest speakers, including occupational therapists, registered dietitians, or certified fitness instructors. They also understand how physical activity can help cancer survivors lead healthier lives, and they can work with individual participants to find out what activities best meet their needs. This is the final workshop session in the series, so it's important to encourage participants to set manageable goals to work towards into the future. Have they identified individuals with whom they will continue to live actively? Do interested members of the group have each other's contact information? Alcoa has the goal to continue building evidence on best practice in the use of the Leaders Toolkit. Through evaluation, we can capture lessons learned from your experience and from those of your participants. We ask that you have participants complete the evaluation surveys in their passports and for you to return them to us so we can evaluate the program and learn about its impact on older adults. We also ask that you reflect on your own planning and delivery of each module and record any changes that you might make. We do welcome your feedback. The intent is to improve the components of the toolkit over time to ensure maximum benefit and to provide guidance on what ensures to be the most positive outcomes. As a community educator working with older adults, you can help by participating in the evaluation process and by communicating with the Alcoa office regarding your use of the toolkit. Thank you for taking the time to view this introduction to Module 6 of the Leaders Toolkit for Healthy Living Workshops for Older Adults. We also invite you to view our other introductory videos specific to each of the 6 lesson plan modules. In addition, we have a video introduction to the Community Leaders Guidebook for you to access. The Active Living Coalition for Older Adults is located in Shelburne, Ontario, Canada. Our website content is available in French and English, and we also have additional resources available in Italian, Punjabi, Spanish, Simplified Chinese, and Traditional Chinese. Enjoy living actively, and thank you for taking part in our workshop series.